From February to August 2017, the Croydon GP Collaborative, in partnership with Surrey Physio, performed a pilot study to see if patients' care could be improved in Croydon.
The Croydon MSK Pilot was born out of a desire to change the current way that physiotherapy and musculoskeletal care was delivered in Croydon.
20 GP training sessions took place over a 6-month period, and the feedback was excellent, with GPs reporting that they felt much more confident examining, diagnosing and managing MSK conditions after the training session compared to before the training session.
The patient pathway was simple, structured and convenient. The patient would see their GP for a routine appointment. The GP would examine, diagnose and prescribe an exercise programme, as well as recommend the patient go on to our website to self-rehabilitate. If possible, the consultation would end without referral to physiotherapy. However, in some cases, physiotherapy referral was deemed necessary and a referral form was filled out. This referral form was emailed to the Croydon Physio team and their admin would process the referral. Within 1 day, the referral will be triaged by a lead or ESP physiotherapist. If the referral was inappropriate, the referral was sent back to the GP with an explanation. Appropriate referrals triggered a contact protocol where patients were sent an SMS, an email or a telephone call. An automated email was sent to the patient to give them a login and password to the website so they could start their self-rehabilitation straight away, if they had not already started it.
An initial assessment was performed by the senior physiotherapist, and if there was a clinical justification, a treatment programme commenced. The Croydon Physio team were trained on how to use EMIS, and treatment notes were inputted directly onto the GP's EMIS system. So the GP had direct knowledge of what had occurred during a physiotherapy consultation. If the physiotherapist was unable to treat the patient, then they were referred onward for further imaging or to orthopaedics via the GP, or if the patient was discharged with advice and a home exercise programme. In many cases, patients were offered follow-up appointments to make sure they were adhering to the exercises and advice, and just to make sure they were getting better. Patient-reported outcome measures were recorded. In some cases, where appropriate, hands-on treatment was provided. The website works like this. Patients are sent a login and password to the site. They select their injury and rate their pain score. They are given exercises, advice and tips, and their condition is explained. They follow the weekly exercise programme. And if they're not logging into the site to continue their exercise programme, they're sent a gentle email reminder. At the end of the exercise programme, they rate their pain scale, so we know have they got better and how many people are getting better. If they need information about other conditions, they can find it here as well, such as videos and various other conditions that people suffer with are all on our website. The GP also has a login section where they can contact us directly in case of any queries. And although quite a few GPs did use this, actually many of the GPs just spoke with the physio at the GP surgery. There are also some presentations and guidelines for the GP, and advice sheets were easily accessible for the GP.
An app was also available for users who wanted the convenience of rehabilitating using their smartphone. It currently has over 100 exercise videos for 15 conditions and 15 specific injury advice sheets and 40 general health information sheets.
Apart from hands-on treatment and exercise therapy, one of the most important things we do is health coaching. So we're encouraging and motivating our patients to stop smoking, to lose weight, to exercise more. Some of the things that we hear our patients say is, I can't exercise because I'm in pain. But you can exercise and there are safe ways to do it, and we can help show you how to achieve these.
1,513 new patients were treated during the 6-month period, with 20 patients referred for MRI. 3,286 follow-up appointments were performed and 0 patients were referred from Croydon Physio to the current CIMS pathway. 38 patients were referred from Croydon Physio onto secondary care via their GP during the 6-month period. averaging just 6 per month. 716 patients actively started a self-rehabilitation treatment programme, many of whom may not have even been referred into the pilot. 1,193 patients were discharged with exercise programmes or recommended to join local gyms. Trauma and orthopaedic referrals were reduced from 488 to 229.
What was trying to be delivered within the pilot was a proof of concept, which is that within the NHS, with GPs being the gatekeepers of demand, that when you put other clinicians around them and in a multidisciplinary team working environment, it leads to improved patient outcomes. So that is primarily what we wanted to do and what we believe we've achieved.
In summary, the MSK Pilot showed reduced waiting times, just 11.5 days on average. A closer-to-home service was popular with patients. 32% or 1,518 patients received an out-of-hours appointment. Physiotherapists and GPs working together as a one primary care team. 89% of GPs suggested they are now confident or extremely confident in managing MSK issues, as compared to 33% at the start of the pilot. Very low DNA did not attend rates, just 3.9%. Overwhelmingly positive feedback from patients and GPs. Increased numbers of patients self-rehabilitating. Significantly reduced referrals to T&O, a 53% reduction in referrals. Significant direct cost savings should the pilot be rolled out across a network or Croydon-wide.
You've seen the data, but what was the feedback like from patients and GPs?
I'm a patient from Farley Road Medical Practice, and I was referred by my GP to Croydon Physio for my neck pain. And the service and the care was very excellent.
It's quick and easy exercises, a very personable manner from the physiotherapists, explaining the treatments they're doing as they're going along. So in all, it's been a very good introduction to physiotherapy for me.
I had some free treatment for 3 sessions, which I'm extremely grateful for. Overall, I can say it's made such a massive difference. It was a pain that just walked with me for 20 years, and I've been coming here now for, I would think it's about 10 or 12 weeks, and I have been more pain-free in that time than I was for the previous 20 years.
Hi, my name is Diane Turner, and I can honestly say after my sessions I feel like a new woman. The team are very professional.
I'm an NHS patient at Portland Road Medical Centre. Well, I've been having back problems for a long time, many years, and they've referred me to the hospital for physio. And I really didn't want to go because it was a group of people and they had different problems. And by coming to the medical centre where my GP's base, it's more intimate and they can deal with the point, the exact problems that I've got instead of in a group situation. Really, really well. I've managed to lose half a stone and I'm exercising because before I thought I couldn't exercise with a bad back, but I was told by the physio that, I should exercise, mild walking, and I've been walking for at least 3.5 miles per day, and I've managed to sort of cut down and eat really healthy food, vegetables and fruit, and it's just sort of boosted my confidence and make me want to go out there and do more, and I'm really, really happy with the service.
I'm a Bridgestock patient. I've been referred to physio, and within a couple of weeks I have been given physio for a really very bad shoulder impingement. So initially when I came, I couldn't even lift my arm above my shoulder, and now I can lift it above my head. And if it wasn't for my physio, I really wouldn't have regained the movement in my shoulder. I really didn't expect to be seen within such a short period of time. So I'm really grateful to the physio team at Croydon. They've been great.
I was referred from Keston Medical Centre, and the service has been really good, no waiting times, and I feel my knee has really improved.
And I'd have to say I've had excellent workout, give me excellent advice and a very good program of exercises which is working. So overall, I would highly recommend your services.
Hi, so I'm Dr. Neil Kelvin, one of the partners here at Selsdon Park Medical Practice. We've had Tim and his team here for the last few months, and I have to say it's gone really well, better than expected. We've had a really good relationship with the team. We've had a good to and fro of information between the two teams. We've had a lot of education from Tim and his guys. We're able to talk about patients on an individual basis, and we feel that we've generally upskilled the team. Patients have given us excellent feedback, saying they're very pleased with the speedy access to skilled physiotherapy, and as a result we have had a significant reduction in the number of referrals to secondary care, and I think overall it's been a very positive experience for staff and patients alike.
We've been piloting the system now for around 6 months. It's been a fantastic pilot. We've had excellent feedback from the patients, excellent feedback from the doctors. It's stopped all patients coming back on a regular basis. They've felt that they've been able to facilitate their treatment plan.
They've stopped attending so frequently for their pain. They all report that they've been seen quickly, been given exercises, and they find that their symptoms are improving. They haven't requested as much analgesia as usual. I even had one patient who was very reluctant to go for physio. He's a plumber complaining of knee pain and he wanted to be referred to a surgeon. I said, I can only do it this route, please try it. He tried it and he loved the session so much he's asked for extra sessions and he no longer wishes to be seen by a surgeon. So we've had brilliant results.
The GP education sessions that Tim has put on at Brigstock have been really useful. As a ST3 doctor, now a GP, I found his explanation of simple things like lower back pain presentations, they've been really useful. They've been clinically really important, and I've helped my patients a lot just explaining to them a diagnosis. Patients really like it, and I've been able to use some of the exercises that Tim has taught us to really help my patients and avoid referrals onwards to the physios and to the orthopaedic team. I've benefited, but I know my patients have as well, and it's been really good.
Very professional, very motivational, and most importantly, it has produced massive results for me as an individual. So I have nothing but good to say about the entire practice, the entire setup.
Brilliant, 10 out of 10.
And please, keep it going, because I need to get this problem solved, and I feel that I'm halfway there.